Stiff person syndrome, about the disease, what it is, symptoms, and treatment. Part -1. Muscle stiffness and spasms are hallmarks of the rare neurological condition known as stiff person syndrome, SPS. The central nervous system is impacted, which has a big impact on a person's mobility and quality of life. The main features of stiff person syndrome, including its definition, symptoms, diagnosis, and available treatments, will be covered in this article. Introduction. A chronic autoimmune disease called stiff person syndrome primarily affects the muscles and nerves. Due to its rarity and similarities to other illnesses, it is frequently misdiagnosed or goes undetected. Though it can happen at any age, SPS is more frequently identified in people between the ages of 30 and 60. A rare and severe neurological condition that impairs mobility and muscles in the body. We hope that this page will help you gain a thorough understanding of SPS, including its causes, symptoms, diagnosis, and potential treatments. Our mission is to arm people with knowledge that will help them and those close to them manage the disease effectively. What is stiff person syndrome? Involuntary muscular contractions and stiffness, particularly in the trunk and limbs, are symptoms of stiff person syndrome. Numerous things, including mental tension, unexpected movements, or exposure to loud noises might cause these spasms. Although the precise cause of SPS is unknown, it is thought to be caused by an autoimmune reaction that interferes with the nervous system's regular operation. It typically impacts the muscles in the trunk and limbs, making movement and posture challenging. SPS falls under the category of autoimmune illnesses, in which the immune system of the body unintentionally targets its cells, particularly the cells in charge of regulating muscle function. Understanding stiff person syndrome signs and symptoms. Each person's SPS presents differently, but typical symptoms include hyperactive reflexes. SPS can result in exaggerated reflexes, which lead to an excessively responsive response when specific body regions are stimulated. Muscle cramps and stiffness may also be exacerbated by this hypersensitivity. Anxiety and emotional distress. Many people with SPS have elevated anxiety, which can make symptoms worse. Daily living and general well-being can be greatly impacted by emotional distress and dread of unforeseen muscle spasms. Postural instability. Muscle rigidity makes it difficult to maintain a steady posture. It may become difficult to walk or even sit without support due to balance concerns. Sensitivity to external stimuli. People who have SPS may become more sensitive to a variety of stimuli, including loud noises, bright lights, and rapid movements. These stimuli have the power to aggravate symptoms by inducing muscular spasms. Causes of stiff person syndrome. Although the precise etiology of stiff person syndrome is still unknown, experts think it may be due to an autoimmune reaction that targets certain proteins in the neurological system. A combination of genetic and environmental variables may cause an autoimmune reaction. Despite being uncommon, type 1 diabetes and thyroiditis have been shown to coexist with SPS in certain people, raising the possibility that these two illnesses are related. Immune system brokenness. SPS is remembered to emerge from a breaking down resistant framework, where the body erroneously targets proteins liable for typical muscle capability. Hereditary inclination. Albeit intriguing, there have been occurrences where SPS seems to have a hereditary component, making a few people more powerless against the problem. Triggers and stressors. In specific cases, outside triggers like actual injury, close to home pressure, or contamination has been related to the beginning or deterioration of side effects. Signs and symptoms. The hallmark symptom of stiff person syndrome is muscle stiffness, especially in the trunk and limbs. This stiffness can range from mild to severe and often leads to difficulties with mobility and posture. In addition to stiffness, individuals with SPS may experience muscle spasms, exaggerated startle responses, and heightened sensitivity to stimuli. These symptoms can significantly impact daily activities and quality of life. Diagnosing stiff person syndrome. Due to its rarity and resemblance to other illnesses, stiff person syndrome can be hard to diagnose. Laboratory testing, clinical symptoms, and medical history must all be carefully examined. The anti-glutamic acid decarboxylase (GAD) antibody test is one blood test that can help identify SPS. To evaluate the functionality of the muscles and nerves, electromyography, EMG, and nerve conduction investigations may also be used. Stiff person syndrome diagnosis. Stiff person syndrome is uncommon, and diagnosing it can be difficult because of its complicated symptomatology. Typically, medical practitioners will combine the following strategies: